also people in their 20s, their 30s, their 50s, and their 60s who do not understand the full, like, what STD screening is. They think it's just blood work when it is not. So good morning. So it is finally sunny outside. I'm gonna go take Summer for a walk now, but as I said in other videos, I like to do stuff for myself in the morning, walk Summer, do my exercise, drink my coffee. But today is a half work day. So in the mornings I have to myself, and then in the afternoon around lunchtime, I'm going to, Summer is already whining. I'm gonna go into the office and see some patients. Lots of procedures today. So hopefully I can bring you along and show you what that's like. All right, cheers. It's actually really sunny outside, so I'm gonna put on sunblock before I go out. I put on sunblock every morning, but I've been using retinol at night and some benzoyl peroxide? No. Dude, I haven't drank my coffee yet. Yeah, I've been using retinol at night because, you know, I'm breaking out a lot. And so my skin is like super dry and I don't want to get a sunburn. So I've been reading this book called Mating in Captivity, and it talks about how in our modern day monogamy society, well, I'm a millennial, so my culture is that we're monogamous and that intimacy wanes over time, passion wanes over time. That's the theory, or that's the belief that a lot of people have, because they don't think that a passion and this roller coaster of emotions is sustainable in a relationship. Like, how can love from someone, in love you need like stability and security, as compared to lust and passion you need more like risk and vulnerability and the unknown. So how are you supposed to have that from one person? So the book goes into talk about how we're supposed to conquer that in our current day monogamous relationships. She said it is possible, and I haven't gotten that far yet. I've only gotten like 30 minutes into it, but I'll let you know if it is possible or not. I've been married for a long time, guys. I'll spare you the details, but yeah, it's always nice to learn about new things, to add some spice into your relationships, okay? Oh, I feel awkward. Too much TMI. And your girl is ready for the clinic. If you're wondering, this is Mandela scrubs. I have a bunch of colors. I found that these are the cheapest and they are super comfortable. I'm in an extra small and I have my stats over there. But yeah, it's a pretty tight fit, especially in the calves.
Yeah, mine.
Okay.
I don't Chuck E. Cheese.
Okay. Are you done peeing?
Yeah.
Okay.
It's running.
Here, look. Wash your hands.
Wash my hands.
Get some soap.
No, my pants are down.
Your pants fell down?
Yeah, don't fix it.
Oh, here, mommy fix it for you. These are Wyatt's pants, that's why.
How my pants are down then?
Oh, here, mommy get you new pants, okay?
Yeah, that one see it's still down. Not a new one.
Okay, we'll get you a new one.
Huh, this one is really dirty. I'll take off this.
Oh, you take off that? Okay. Because that's Wyatt's pants?
Yeah, this one's dirty.
All right, guys, so back to what I was saying about millennial monogamy. I feel like I've been seeing a lot more polyamorous relationships recently. I don't know if it's because of the area that I moved to, or if I just stumbled on a different side of TikTok, or it's just more of a Gen Z thing. I don't know. Comment down below if you guys have seen the same, or if you're in a polyamorous relationship, and if you're a Gen Z, if that's just like you all are more spirited. I don't know what it is, but my thoughts on it is that more power to you. I think you should do whatever floats your boat, whatever makes you feel strong, empowered, and, you know, love yourself more. I am all for that. My thing is that sexual education within our system, at least in the United States where I grew up, is laughable. Like, they did not teach us anything in sex ed. If you guys haven't seen it already, I made a video on how to not become pregnant. I will link that in the description box down below. But I also have seen in every age group, not just younger populations like in their teens, but also people in their 20s, their 30s, their 50s, and their 60s who do not understand the full, like, what STD screening is. They think it's just blood work, when it is not. So let me tell you what it is and tell you what we do when we screen for STIs. Obviously, when you're in a relationship or even a polyamorous relationship, the safest thing that you can do is to get screening for STIs, also known as sexually transmitted infections, prior to sexual engagement. And those include several things. So for some of my patients, they think that STI screening is just blood work. Take your blood and they screen for everything. That's not the case. When we are checking your blood, we're looking for blood sexually transmitted infections such as HIV, syphilis, and hepatitis C. Nothing else. There's some labs that we don't usually check for sexually transmitted infections, such as herpes, also known as HSV1 or HSV2. And the reason why we don't do that is because the majority of people already have it. And you usually get it in childhood, where your grandparents or parents or adults love you so much and they kiss you, transferring the virus. So like cold sores, if you have them and you're worried about them, then we just do a swab. Or down there, we would just do a swab and send it off. And if we know that you have active infection, then we just send in medication. The lab work itself will only tell us that you had previous infection, not active infection. The most common sexually transmitted infection that has a risk of developing into cancer is, you guessed it, HPV, also known as human papillomavirus. Your body naturally fights off this virus, but sometimes it doesn't. This can lead to things like genital warts in low-risk strains and cervical, throat, anal, or rectal cancer in high-risk strains. According to the CDC, everyone will get HPV at one point in their lifetime. The prevalence of HPV in adults ages 18 to 59 is 45.2% in men and 39.9% in women. So how do you protect yourself? Number one is barrier protection. So condoms, oral dams, saran wrap, anything that works as a barrier against bodily fluids. Next is the HPV vaccine. We usually recommend this vaccine starting at age 9, not because we think that our 9-year-olds are going to start having sex, but rather because the vaccine works better prior to exposure. There's 39 different types of HPV that we know of so far, but approximately 13 that are high risk that can eventually develop into cancer. For those with a uterus, we specifically screen for cervical cancer by doing a pap smear, getting a cell sample from the cervix, and for those over 30, we also check for HPV. If that comes back abnormal, then occasionally we will also do a colposcopy, which we use this special machine, which works as a microscope to look at the cells, and then possibly also take a sample from the cervix to send off to pathology to look under higher magnification. So I inserted a Nexplanon. Cool, huh? This is the one that goes in your arm. Anyways, I was saying that Other things that we test for is specifically that is most important when you're screening for STIs, and the most common is gonorrhea and chlamydia. And those things are only usually found in body secretions. So in the vagina, in the penis, in the rectum, in the eye sometimes. So if you get shot in the eye, sometimes you might just have like eye pain, eye redness, lots of discharge, but sometimes you won't have any symptoms at all. Like you won't have any itching, you won't have any pain when you pee. People with a penis more commonly won't have any symptoms. And so that's why we check. There's two ways you can check, where we just do a swab. That is the most accurate. Other times, if you don't want to do a swab, we can do a urine to catch it. But there's a correct way in doing that. So what we want you to do, the best time is first void in the morning. If you can't hold your pee for that long, then we recommend at least 2 hours. And you want to do it where it is dirty catch. So that means that you're not wiping at all. You're just catching the pee right away. So it's different from checking a urinary tract infection, right? So the reason why is we want to catch all the bacteria that is coming out to see if you have it or not. So sometimes you can have a false negative if you had cleaned before, or like you not enough of the bacteria has accumulated in your urine, and then we send it off and then it comes back negative. But if your partner is positive, you should definitely get treated, or at least screened and treated. So yeah, that's my 2 cents. Oh, it's so rainy. I'm so sad. Is this not just the saddest thing you've ever seen? Oh, so sad. And that's all we had for today's video. I hope you all enjoyed and learned something today. If you haven't already, please subscribe, join the family. We put out new videos at least once a week. Give this video a thumbs up so it really helps us out with the YouTube algorithm, and we'll see you again next time. Peace.
This is our house down the because I want to move to a house.
This is a house.